Hello, my name is Lena Biondolillo, and I am a program specialist in the Children's Developmental Disability Program at the Idaho Department of Health and Welfare. This video is going to provide a brief overview of the traditional and family-directed services pathways in our program. There are two different programs or levels of care that a child can access in our program: support and intervention. This video is going to focus on supports. Once a child is found eligible, the parent or guardian can then choose between the traditional or family-directed pathway. There are 4 budget tiers for support services in Idaho: $4,900, $6,200, $8,400, and $14,900. When your child is found eligible, the letter will include their budget amount. This is the amount that can be spent on support services. A plan will be developed to outline goals for your child and how the funds will be spent. Let's talk about the services available on each pathway. On the Family Direct pathway, parents can choose to hire a community support worker, or CSW for short. This is a person who works one-on-one with your child. In addition, there are some unique services and adaptive equipment available on the FDS pathway. These services must be recommended by a professional that is treating your child. Parents choosing Family Direct have more flexibility and more responsibility for managing the program. The parent or legal guardian must complete 2 training classes, and the parent becomes the employer. Also, please note that a child must live with their parent or legal guardian, and that power of attorney is not sufficient for the FDS pathway. Parents recruit, hire, set wages, train, and discipline employees as needed on the FDS pathway. As a parent in FDS, you are becoming an employer. There are systems in place to help you manage this responsibility, but it requires more from parents than the traditional pathway. The services available on the traditional pathway are respite, community-based supports, and family education. Respite provides supervision to the child on an intermittent or short-term basis because of the need for relief of the parent, who is the primary unpaid caregiver. Respite can be one-on-one or in a small group. It cannot be used while the caregiver is working. Respite cannot be provided to a paid caregiver. Community-based supports help your child to join in activities in their community as independently as possible. CBS helps your child explore their interests and practice their social and relationship skills. It can be provided one-on-one or in a group, and through a DDA or through an independent provider. This service provides an opportunity for participants to explore their interest, practice skills learned in other therapeutic environments, and learn through interactions in typical community activities. Family education helps parents and caregivers work together on things such as understanding your child's disability, parenting skills, or how to use adaptive equipment. It is education by a professional to family members or others who participate in caring for the child to help them better meet the specific needs of the child. On the traditional pathway, parents have options for the provider of support services. Parents can choose to work with a developmental disability agency, commonly referred to as a DDA, or an approved independent provider. Your case manager can help you find a provider, and there are provider lists available on our program website, which is on the last slide of this video. There are many benefits to the traditional pathway. There is more guidance available to parents choosing the traditional pathway. DDAs provide a supervisor, keep records, and hire employees to work with your child. They can also help you problem solve as needed. A case manager is assigned to assist your family while your child is in the program. A case manager can help you understand your options and resources available in your community. Case management is optional on the FDS pathway, but included on the traditional pathway. These are program contacts for additional information, depending on which part of the state you live in. There is also a link to our program website for additional information. If you have already been assigned a case manager, they can answer questions specific to your family.